Hello, good afternoon, everybody. My name is Anshuman Chandra, and I am with Rijuven Medicare India Private Limited. We have created a concept called Clinic in a Bag for healthcare diagnostic services in rural parts of India, where the trained professionals and healthcare services are not available or are in scarcity. Now I'll introduce you to this concept and solution. So we have this clinic in a bag over here, which has all the devices, diagnostic devices, right from vitals to cardio sleep for cardiac checkups, spirometer for the lung checkup, ENT scope, a tablet where all these devices and many more are integrated into the tablet. Now, there are three pillars to this whole solution. The first pillar is this bag, along with the tablet and the software and devices, which is deployed at the field level, which we call the rural area, or where the diagnostic data is captured from the patients. This is the first pillar. Second pillar is the algorithms in the cloud, which actually work on that data like any general physician would work, and send the color coded reports back to the tablet at the first pillar. Now, why are the color coded reports important? Because in the village, when you don't have trained professionals, if you have an ASHA worker who is not trained to read the ECG reports or any other diagnostic reports, she needs to understand only three things. Is the person fit, which is in green? Is the person in a borderline case, which is in yellow? Or is it red, which is emergent, and the person has to be taken to a hospital as soon as possible? So these three things are introduced to the in the report by the cloud. That's the second pillar. Then the third pillar is the doctor's portal, which is used by doctors sitting remotely anywhere in India, or I may say anywhere in the world, because they just have to log in with their IDs and they'll get access to the practice, and they get the diagnostic data along with the patient's details, and they're able to deduce and recommend and even prescribe the scheduled medicines which are allowed by telemedicine guidelines of India, sitting remotely. In that case, what happens is when the report, as soon as the patient doctor feeds the details in the portal, they are instantaneously within seconds through the cloud routed to the tablet at the field level, which can be printed off or sent on WhatsApp to the patient, so that it is easy for him to keep record. Now, all this data is kept together at one place, can be accessed even after 5 years, the continuous data, and you can form a proper health chart of individuals through regular diagnostic services. Now, I will just quickly take you to the key component of this bag, which is cardio sleeve. Cardio sleeve is a US patented FDA approved for clinical usage device, which is a one of a kind device in the world. Now, this can conduct three functions. It has two dry electrodes over here for ECG. It has the stethoscope diaphragm, and it has a microchip inside which combines both the signals for different tests. Now, the first test that we do for this is auscultation of the four valves. So you place it on four positions as guided by the tablet. Now, all these things are being guided to the ASHA worker or the operator on the tablet through videos when they're operating. Now, if we go to auscultation, you see aortic valve. It tells you exactly where to place it. If I change it to pulmonary, it will change the image and it will tell you to place it on the pulmonary valve. So once it's done, then you place it and the data is captured. Similarly, once this thing is done, auscultation of four valves, you have 3-lead ECG. In a similar manner, you place this device where it is told as per the video, you collect 3-lead ECG data, and you can detect arrhythmias, which are 21 kind of arrhythmias can be detected instantaneously on the spot. Again, it is red and green for this purpose. Then you have the third test, which is cardiac function, which is a very important test in today's time, which determines premature heart failure, which is basically the muscle pumping strength of the heart, wherein you see a lot of cardiac arrests happening with people. People are dying, are collapsing because of heart attacks. This is what it can detect in a premature level when it is about to happen. This device does these three tests, and then we have the spirometer, which can do your lung test, lung function test, and a pulmonologist gets a complete peak flow chart sitting remotely. The patient has to give the sample. Again, all these devices are Bluetooth devices. There is no manual intervention wherein a person has to feed in any data inside this. You give the sample over here, it reaches here, it reaches to the cloud detects it and creates a report in red, yellow, green for you. Now, then we have even the blood tests over here, which are the point of care tests. Then we have the visual tests through, the ENT high definition scope. So all these things are done at one place, and sent to the cloud, kept in the cloud as well. So all your data is stored there. Now, this device can be useful at places where you don't have trained technicians. Obviously, that's the case. Now, to sort out the rural issue, Optiemus has is decided to use drones to not deploy the bags permanently in these rural areas, but to be sending these bags. Now I'll hand you over to Divyansh, who will actually explain to you about
Hi,
the drone service.
hello. My name is Divyansh from Optiemus Innovations System. So basically, nowadays, getting a medical assistant in a very short time is a very big challenge to save lives in remote areas and like mountain areas or rural areas. So using the medical this medical kit capability and putting in our drones, which are capable to fly a very long range and with a long endurance. So in a remote area where a normal ambulance or some normal doctor by a car or by a road not approachable, so we can use our capability of drones to send this particular kit, and by using, as said by sir, by using our asha workers or small technicians there or a local people, we can guide them to use this medical kit and save lives. So basically, this 4 to 3 to 4 kg medical kit can be mounted in any drone which can fly 10 kilometer or 5 kilometer and come back while delivering all this medical help to a particular person who need it. So in this way we are solving this remote area medical assistance. Thanks.